Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is a nice example of a kind of a newly recognized entity, which is immune checkpoint inhibitor-induced colitis. So this is a case of a 48-year-old male patient who's known to have lung carcinoma, for which he was receiving immunotherapy, and he presented with diarrhea. This is the single most common presentation of colonic manifestations related to immunotherapy, diarrhea. And as you can see here from the low power magnification, this is colonic mucosa. And I'm going to zoom in here. This is where we have the clue to what was going on. This is a collagenous colitis. There is thickening of the subepithelial membrane that is easily recognizable, and this is on higher power magnification, again here showing the thickened subepithelial basement membrane or collagen that is further highlighted or confirmed with Masson trichrome, especially stain. Now, in general, this was not accompanied by lymphocytic colitis, another manifestation that sometimes can be seen in association with immunotherapy-induced colitis, especially when the patients present with diarrhea in the absence of really endoscopic changes. However, the diarrhea persisted, and they had to repeat the endoscopy 6 months later. And as you can see here, there is persistence of the thick collagen subepithelial collagenous band, further highlighted again with the Masson trichrome special stain. But in addition, we start to see features of active colitis. So we have here a cryptitis, inflammatory cell neutrophils infiltrating the epithelium, and the lamina propria became very busy with many inflammatory cells. There is even increased number of apoptotic figures. And another focus, this biopsy was taken actually from the left side of the colon, specifically from the descending colon. And this is important to know because in addition to the neutrophils that we are encountering here, we started to see Paneth cells. And the presence of Paneth cells always is a reminder in the left side of the colon that this is like inflammatory bowel changes. This is consistent with chronicity, with the chronic features. And another focus where we have here distortion to the architecture of the crypt in the presence, in addition to Paneth cell metaplasia. So we have features of active colitis, we have features of chronic colitis. Here, for example, we have thickening of the muscularis mucosae, another focus, another fragment of tissue from the left side of the colon, thickening of the muscularis mucosae, the presence of really heavy inflammatory infiltrate with the plasmacytosis, basal plasmacytosis, increased number of plasma cells at the basal layer near the muscularis mucosae, in addition to Paneth cells, perhaps, which is the easiest to be recognized. And another focus, again, where we have the muscularis mucosae, the inflammatory cells that are rich in plasma cells, and we have then Paneth cells. So as if we're talking about inflammatory bowel disease of ulcerative colitis type. So in addition to the collagenous colitis that the patient initially presented with, probably in relation to the immunotherapy, the patient 6 months later developed what appeared to be inflammatory bowel disease, ulcerative colitis type, like colitis. So the final diagnosis in this case is immune checkpoint inhibitor-induced colitis. This is really a tricky area because if you are not aware that the patient is receiving immunotherapy, the case might be missed and the diagnosis something else. Or if you know that the patient is receiving immunotherapy, but you're not quite sure of the spectrum of the colitis induced by immunotherapy, you might also miss the case. So remember that immunotherapy can induce a range of colitis in patients who are on treatment, whether on acute basis or on a chronic basis. And this ranges from lymphocytic colitis and collagenous colitis, or what what we call microscopic colitis, to inflammatory bowel disease, ulcerative colitis-like features. Sometimes we have only inflammation, sometimes we have only apoptosis. I have in the caption a link to a very nice review article that talks about the different GI manifestations of immune checkpoint inhibitors that a reporting pathologist should be aware of. I hope you find this tip useful in your daily practice. Thank you.